Hi, my name is Selena Elon, and I'm doing my presentation on bulimia. So, what is bulimia? Bulimia is a potential life-threatening eating disorder characterized by a cycle of binging and purging. Purging is behavior with the purpose of undoing or compensating for the effects of binge eating, such as the misuse of laxatives or self-induced vomiting. So, the history of bulimia. Purging was a common practice in ancient Egypt, Greece, Arabia, and Rome as a form of treatment against diseases. Physicians prescribed it because they believed that diseases came from foods, and purging would rid the body of the infected food. The medical term for bulimia nervosa wasn't coined until 1979, when Gerald Russell published his paper on psychological medicine describing the illness. After treating roughly 30 instances of the undefined eating disorder, he realized that it did not fit the diagnostic criteria for anorexia nervosa. At first, the medical community disagreed with his conclusions, but by 1980, bulimia nervosa was included in the third edition of the DSM. Soon after, popular women's magazines started describing the effects of a new binge purge syndrome. Through the media exposure, binging and purging became the new strategy for weight management. Bulimia became extremely prevalent in college campuses, especially in sorority houses. This is possibly caused by the impressionability of young women, newfound stress, influence of negative peer support, and lack of healthy coping mechanisms. Caroline Adams, a published author, states, "Some colleges are notorious for bulimia and anorexia. I've heard that some houses have plumbing problems because of all the vomiting going on." Statistics. 80% of people with eating disorders started with dieting. 25% of Canadian women of normal weight think they are obese. 56% of Canadian women are on a diet, and 4.5% of Canadian adolescents have bulimia nervosa. What causes bulimia? So, important figures in life, like relatives or close friends with obesity or an eating disorder, stressful life events like moving to a new place or losing a loved one, being overweight as a child or a teen, or even having a family member that's overweight or obese, poor body image or self-esteem that leads to negative thoughts, unrealistic perfectionism, persistent worrying, or feeling like you're never good enough, having a job or playing a sport that prioritizes body image, like gymnastics, ballet, or modeling, and pre-existing psychological problems like depression and anxiety. These are all environmental causes that can lead to bulimia, but research is currently being done to see if any biological stuff can possibly cause bulimia. Symptoms. So, binging, eating a large amount of food in a short period of time, accompanied with a loss of control and inability to stop eating. Purging, getting rid of the body of food through self-induced vomiting, laxatives, excessive exercise, etc. Restricting, fasting, limiting amount of calories, or avoiding certain foods in between binges. Fixating, this means preoccupation with body size, living in constant fear of gaining weight, and basing self-worth on how much they weigh. Warning signs. So, constant worrying about body weight, shape, or size, like repeated statements about needing to go on a diet or complaining about how they look, repeatedly eating large amounts of food in one sitting, strict dieting or fasting between binging, secretive about eating, not wanting to eat in public or hiding food, going to the bathroom right after eating, during meals, or for long periods of time, sores, scars, or calluses on knuckles or hands, damaged teeth and gums, and facial and cheek swelling, which are all caused by self-induced vomiting, and abnormal weight fluctuation. Diagnostic criteria from the DSM-5. So firstly, it's recurrent episodes of binge eating, which involves eating an unusually large amount of food in a discrete period of time, and a sense of lack of control over eating. Recurrent inappropriate compensatory behaviors in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting, or excessive exercise. The binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. Self-evaluation is unduly influenced by body shape and weight, and the disturbance does not occur exclusively during episodes of anorexia nervosa. The current severity of the disorder also needs to be specified, which is measured by how many compensatory behaviors are done by the patient per week. So mild is an average of 1 to 3 episodes per week. Moderate is an average of 4 to 7 episodes per week. Severe is an average of 8 to 13 episodes per week. And extreme is an average of 14 or more episodes per week. You would also need to specify if the patient is in partial or full remission. Partial remission means that some symptoms are still present, but the full criteria is no longer met. Full remission means that none of the criteria is met for a period of time after the full criteria was previously met. Treatment. So psychological counseling, such as cognitive, dialectical, or emotion-focused behavior therapy, this helps replace negative, unhealthy thoughts and behaviors with healthy, positive ones. Family-based treatment for younger victims of bulimia that focus primarily on parental intervention. This also helps family members deal with problems that may arise due to recovery. Peer support groups also allow group members to connect with people going through similar struggles. A person struggling with bulimia can also take medicines like antidepressants. The only antidepressant specifically approved by the FDA to treat bulimia is fluoxetine or Prozac, which is a selective serotonin reuptake inhibitor. Dietitians can also assign a meal plan to encourage healthy eating habits. Outpatient treatment is also another option. The patient would spend a number of hours at the program and eat meals there, but they can still continue to live at home. These programs are staffed with a great team that includes psychiatrists, nurses, psychologists, dietitians, social workers, and counselors. Lastly, if the bulimia is really severe, inpatient hospitalization may need to be done. So what is it like to live with bulimia? So firstly, I have this comic strip by Abby Howard that perfectly describes the vicious cycle that you can get stuck in. So first, you wake up in a haze of self-hatred, so you don't eat. And then in lunchtime, you get really hungry, so you eat something because you deserve to be happy. And then your mind makes you think that you don't deserve that, so you find a bathroom and puke. Then you get hungry and eat again, and then you realize that it's not okay, and then you puke again. And then you manage not to eat until dinner, and then you feel disgusting, and then you puke again. You get a nosebleed from puking too hard, and then you sit around thinking about how much of a mess of a human being you are. And you probably puke again. Then you tell yourself, tomorrow will be better. But the cycle repeats again, and then you wake up in a daze of self-hatred, and the cycle just keeps going on. I also have an article. Okay, I need to drink water. Okay. I also have an article from HuffPost about what typically goes on in a day in the life of someone struggling with bulimia. So the first thing that she does after she wakes up is check her body in the mirror and weigh herself. She states that the number on the scale is directly proportional to how she feels that day. She then cleans up the mess from last night's binge session. She no longer has a period, her hair is getting thin, her nails are brittle, and her skin is dry. She's also tired all the time. She comes to work and notices that someone brought donuts. She eats too much and immediately rushes to the bathroom to purge. She puts on some eye drops that she always brings with her to cover up the red bloodshot eyes due to purging. She goes home for lunch because she does not want anyone to see how much she eats. When she does eat in front of others, she tries to eat very little and then ends up bringing food home afterwards. Ends up binging at home afterwards. When she orders takeout, she buys several drinks to make it seem as if it's for more than one person. She goes to the grocery to buy a huge amount of food so she can binge at home in the evening. At the end of the day, she says, and I quote, "I can't believe this has been my day again. Am I possessed or something? I eat enough for 3 people. Maybe I have a multiple personality disorder. Maybe it's a demon possession. I can't stop this even though I want to stop." The problem with bulimia is that the problem is not about food at all. Instead, it's a means of control. People who struggle with bulimia often say that they get a high from the binge purge cycle. It has something to do with being able to let go and consume all you want momentarily, then be in control again when you purge everything out. The truth, however, is that you never realize that you're no longer in control until you notice that you're stuck in a cycle that you can't get out of. Bulimia truly takes over your life, making it an extremely dangerous psychological disorder. When you have bulimia, you will constantly think about food and even plan your day around your binging and purging, spend a lot of money on the food you binge on, lose your gag instinct, and resort to weird methods to make yourself puke. Smell because shockingly vomit smells. Be severely dehydrated because purging rids your body of water. Experience tooth decay caused by the stomach acid from purging. Stigma. There is a lot of stigma around eating disorders and bulimia as well. This is particularly damaging because bulimia is an extremely dangerous and harmful illness. Stigmas like these can prevent someone who is struggling from getting the help they need. Since bulimia is a type of eating disorder, people usually assume that a person struggling with it looks underweight. One would hear, "You don't look like you have an eating disorder." This is extremely damaging because most people who struggle with eating disorders feel as if they're a fraud because they are not thin enough or not sick enough, therefore deciding that they do not need help or treatment. The need for proper care should not be determined by how the person looks or how much they weigh. A really striking quote that I read from eatingdisorderhope.com says, "Just one day struggling in the darkness of an eating disorder is enough to deserve proper treatment." Another stigma is that only women have bulimia. This is not true at all. Statistics show that an estimated 10 to 15% of people with bulimia are male, with LGBTQ plus men and athletes being at a greater risk for developing bulimia. Men are more prone to over-exercising as a form of compensatory behavior, which makes it more difficult to diagnose. Harmful stereotypes like these also do not help at all. "It's just a diet for your weight. I go on diets all the time. Why make such a big deal out of it?" And people with an eating disorder choose to have it, and they should just snap out of it. Like we talked about earlier, eating disorders affect your state of mind. Most of the time, it isn't even about how much you weigh at all, it's about control. The vicious binge purge cycle is also extremely difficult to get out of, and someone struggling with it just can't snap out of it that easily. Interesting facts. Laura Prepon, who starred in That 70s Show and Orange is the New Black, Amy Winehouse, and Nicole Scherzinger from the Pussycat Dolls have all struggled with bulimia. During the filming of That 70s Show, Laura Prepon needed to have 2 wardrobes because of how much her weight fluctuated. Anyway, this goes to show that eating disorders can affect anyone, even the most successful celebrities. New developments. Research in 2018 found that perfectionists are more likely to develop bulimia. Perfectionists hold unrealistically high standards for oneself and others, are rarely satisfied with themselves, and engage in harsh self-criticism when they fail. Binge eating can offer perfectionists a temporary escape from the pressure that they put on themselves. These results suggest that treating perfectionism as early as possible can help stop the development of bulimia. Research in 2017 found that the brains of women with bulimia respond differently to images of food after exposure to stress compared to brains of women without bulimia. The study was conducted by scanning the brain activity using an MRI of how women with and without bulimia react to pictures of food. Before the study, all the participants were given the same meal with the same amount of nutrients. Then they were asked to answer some difficult math problems. After that, they were shown images of food. The brains of women without bulimia showed an increase in blood flow in the proscenius, while those with bulimia showed a decrease. The proscenius is part of the brain associated with self-perception and memory. Women with bulimia having less activity in the proscenius when seeing food means that they may be using food to avoid thinking about themselves, especially during or after exposure to stress. Research like these help us better understand bulimia as an eating disorder, and further down the road allow for better and more effective treatments for recovery. And that is the end of my presentation. This definitely ran on for much longer than I thought it would, but I hope you enjoyed it anyways, Ms. Maris, and I hope you're doing well and staying safe. And here are my list of reference, which is really long and in a tiny font, but I hope you can see it anyways. Okay, boom, done, bye.